get ready to take control of your healthcare. Here's your host, Ray Cobra.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Cobra. I am your host, and I have with us today Stephanie Koch, human resources woman extraordinaire. Welcome to the big show, Stephanie.
Thank you. It's
Awesome.
quite a greeting. Well, I love this racket. It's become a huge passion of mine over the past few years. I've actually been working in human resources over 25 years. And when those words come out of my mouth, I'm like, how the hell did that happen?
I'm right there with you.
Yeah.
Time flies when you're having fun.
Yeah. And, what's interesting is for so many years when I first got into HR, I was working with companies that had fully funded healthcare plans. And, initially when you're starting out in your career, you're there in a meeting to listen and you're absorbing information and you're learning. But as I got more immersed in those fully funded healthcare conversations, I remember thinking, there's something about this math that doesn't add up. But again, I didn't know enough to understand what it was, but something didn't seem right. So when I was 30, I was asked to move down to Tampa to be a regional HR representative for this large company I was working for. And unfortunately, about a year after we moved to Tampa, the company went under. So being that we had made the move and we realized that the cost of living at the time in the early 2000s, that was much more reasonable than living up north, we decided to make a go of it and we stayed. And I ended up working for this company. That's where I was working for 11 and a half years, where we were fully funded. And, that's when I really started really grasping healthcare as best as I could. From there, back in 2013, because I worked there for 11 and a half years, I went to a company that was self-funded. Because I didn't know any better, I said, hell no, that is not a good idea. And I don't think that's something you should do. So that was
Thank
my
you
first
for your honesty.
reaction.
Ladies and gentlemen, that's an honest answer.
It's very honest because that's what happened.
That's usually the gut reaction, right? It's human nature. It's fear of the unknown. It's like, well, wait a second. I'm not so sure. We're going to have to talk about this and unpack it a little bit. Yeah.
Yeah. And that's where the story of my love for healthcare really started. But there was definitely that moment of, this is something that is so unfamiliar. I've never heard of it. I work in HR and I'm supposed to be the one, to really understand all this,
And give me the time frame again. What year is this?
So this is 2016.
Okay.
And that was when, again, we, despite doing all this stuff with the carrier being self-funded, demographics weren't bad. We had a group of 450 employees. I think we had about 600 covered lives. But, I will tell you that I have been very blessed to be very included as part of executive management, even being in HR, because HR has such a huge value proposition. I mean, healthcare itself being the second or third largest line item that a company has. But if you think about all the programs that HR has to facilitate and be responsible for, there is a lot of opportunity for, and I always say this, HR can really be a profit center and stuff.
Yeah, because there's so much, it's just a system that's fraught with waste and abuse. And so
I was going to mention that, like, as an HR person, like having to understand and unravel what, we're trained that, even as people who live in the US, right? So we are trained that there are these big companies, and if their logo is on the card, you have the best insurance.
We have the best healthcare in the world.
But if you think about how many years people have believed that, and as HR professionals, the people that we have been partnering with for so long make us believe that we have the best healthcare in the world, which are the BUCAs. But now what I had to do when I was trying to get my mind unraveled from what that was, because I was like, well, if I can have a similar plan self-funded, what does that look like? I needed to have a visual of what that was. And I remember I helped
Yeah.
the new broker at the time create this diagram, and it was like, here's what your current plan looks like, here's what the new one looks like, and essentially it's the same. You're getting the same products, you're just able to select who's going to support your plan. So
Got it. So you're paying your claims as you go,
yes,
month to month.
yes, and we actually, we do fund for max loss. So some companies, will change that.
That's what I was getting at. So
Yeah.
you're funding the plan to max loss,
Yes.
meaning that you're paying as if it's your worst case scenario.
Correct.
And
I've even thought to myself, because I spoke at a CFO conference in Boston a few months ago, and we were talking about what an HR professional or the model HR person should look like now versus what it was thought to be even like 5 years ago.
yeah,
And the question and the conversation about, well, number one, it should be somebody that does have some financial background, but they should also, have a dotted line to the CFO, definitely work directly with, the CFO, but also companies that say they can't afford to have someone working in HR to focus on healthcare. I said, you can't afford not to.
yeah,
That was
yeah.
basically what I told them, because they're leaving money on the table.
Yeah, and so I had a friend, Neil, back in the day. He was a waiter in a restaurant. I was a bartender in college. I met him there, and brilliant guy, Cypriot guy, came over, first generation here, best work ethic of anyone that I've ever run into before. And he was also involved in construction. He did a bunch of different things. Brilliant
Yeah.
guy. And he said, Ray, you should not feel bad about hiring a contractor and asking a contractor to break down their services. How much is this going to cost in labor? How much is it going to cost in material? And what's your profit? And that lesson I carry with me to this day.
Yeah.
Like, that's something that you deserve to know.
We work with One Digital. They've done a great job with us and for us. And we want to work with vendor partners where we are going to feel valued, and we're not going to be like a small fish in a big pond.
Mm-hmm.
You know what I mean? Like, we have
Yeah.
to feel like, when they are meeting with us, we don't want to feel like they took the same presentation and just kind of pasted our name on. It has to be customized. And
Right.
that's where I think it's meaningful, is if you are a broker advisor, you have to understand the client or the prospect you're meeting with. You have to know the employees, the culture, and build a plan that really supports that. It's not a one size fits all,
Yeah.
because not every client or prospect has the same challenges. Cost is one thing, but how to solve for the cost is going to be different based on the client.
Right.
One of my employees goes in, and the doctor, and I get really emotional about it, but the doctor says to him, did you know you had a lump in your neck?
Oh boy.
Here he is trying to win the PTO, and lo and behold, he had stage 4 cancer. He had no idea.
Oh my God.
And thank God he's happy and healthy. But, had that clinic not been there just to do a preventative wellness exam, I don't know what would have happened.
Wow. Hendry Marine.
Yeah.
Amazing.
Thank you.
Amazing. We need more HR professionals like you. You are a shining example of what the future of HR needs to be, in my humble opinion. And thank you for caring. Thank you for being engaged. Thank you for all that you do.
No, thank you. That was a huge compliment. I really appreciate it. And that is the plan. I just want to keep getting out and having as much of an impact for my HR professional or my professions, the HR profession, as I can. So I really
Awesome.
appreciate that. Thank you.
Keep up the great work. All right, ladies and gentlemen, thank you for joining. Until next time, peace and love. Peace and love. Have a great one.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.